Before we begin discussing the injuries, it is important to know that we will be discussing this in anatomical position. That means that our left and right is actually the patient's left and right. For example, this is a patient's right with the viewer's left, and this is a patient's left with the viewer's right. Using anatomical position allows there to be a standard and universal way to describe the body and injuries, especially in emergent situations like this.
The right hypochondriac region is here. Using word roots, it can be broken down into pertaining to below the cartilage on the right side. On the left side of the body is the left hypochondriac region. The next region is the epigastric region, which is broken down into pertaining to above the stomach. It is located here. Below the epigastric region is the umbilical region. It is easy to remember this region as it is where your belly button is. Below that is the hypogastric region, which pertains to below the stomach. The next region is the right lumbar region, which is next to the umbilical region. To the left of the umbilical region is the left lumbar region. The right iliac region is below the right lumbar region. It is also to the right of the hypogastric region. The left iliac region is to the left of the hypogastric region.
Using all of these terms can be confusing, especially during emergent situations. There are 4 quadrants that we use to refer to these areas in the abdominal pelvic cavity.
The patient has hurt their head. There is a possibility that they have injured organs within the dorsal cavity. The dorsal cavity protects the nervous system. It consists of the spinal cavity, which encases the spinal cord, and cranial cavity, which encases the brain. In these cavities, the spine and the brain are the organs included. The brain is superior or closer to the head than the spine. The spine is posterior or closer to the back of the body than the brain. The head and the neck are also part of the axial skeleton. The axial skeleton is one of the 2 regions the body is divided into.
Now that we've examined the injuries to the head, we can examine the minor injuries sustained during the fall. The patient has fallen onto their chest, and the major point of impact is the ventral cavity. The ventral cavity contains all the body's internal organs. It is anterior or in front of the dorsal cavity. It is also a part of the appendicular cavity, which contains the body's appendages. Let's take a look at the ventral cavity.
This cavity has 2 subparts, the thoracic and abdominopelvic cavity. The thoracic cavity contains the heart and the lungs. The heart is medial or towards the body's midline to the lungs. The body's midline is an imaginary line on which the mid-sagittal plane lies on, dividing the body into equal right and left parts.
Next, we'll look at the abdominal pelvic cavity. This cavity has 2 subparts, the abdominal cavity and the pelvic cavity. The abdominal cavity contains many organs, such as the stomach, intestines, liver, and spleen. The pelvic cavity contains our reproductive organs, the rectum, and the bladder. Your hip bones are lateral, or to the side of and away from the midline of the body to your bladder. The abdominal cavity and the pelvic cavity are divided by the transversal plane. This means that they are divided superiorly and inferiorly, or closer to and farther from the head. Though there is no physical separation, the 2 are transversely separated.
The abdominopelvic cavity is inferior or below the ventral body cavity. The rib cage protects a lot of your body. It is protection for the organs in the thoracic cavity. These organs are deep or farther away from the skin than the rib cage. Another fun fact about the rib cage is that it lies on the frontal plane. This means that the ribs divide the body into its front and back parts.
It looks as if our patient has sustained injuries to the knee. Let's take a look. The knee is proximal or closer to the limb's attachment point than the ankle. If we look at our patient's knee, we can see that there is nothing emergent. The knee and the ankle both look good.
When our patient fell, they hurt their foot. Let's make sure there is no pain to the foot.
As we said earlier, we did not see any problems with the ankle. Looking at the foot, there is no injury, just some minor pain that will pass. The toes are distal or farther from the limb's attachment point than the ankle is.
Examining the bones in the patient's body is important to ensure that the patient does not have any broken, fractured, or injured bones. Though the muscles and tissue surround the bone, it is important to make sure that the bones are not impaired. The muscles are superficial or closer to the skin than the bones in our body.
Thank you for joining us today as we examined our patient. We hope you learned a lot, and stay tuned for the next episode where we learn about word roots and language.